as we think as pediatricians about the coming school year, I think everybody feels very similar that a huge goal for everybody is that all kids have the opportunity to have in-person school 5 days a week and be safe. And we learned a lot last year about the things that can help keep kids safe in school. And vaccine for kids 12 and up at this point provides a really important mitigation strategy that you can do for your child and your family to keep your child safe and able to go to school and learn. We have seen through studies and through the mass distribution of the vaccine that it is safe and effective. And we are really happy to see it being given right now in kids who are 12 and up, and hopefully soon for younger kids than that. Kids tolerate the vaccine well. They have very good response to the vaccine, and it has a profound effect at keeping, again, the child, you as a family, the school, and our entire community safe as we think about returning to school. One of the most important lessons we learned from the last year is the importance and effectiveness of masking in preventing the spread of COVID disease, particularly in the school setting. And it is something that allowed us to reopen schools in person safely without concern for transmission in the school. And so because in our schools we're going to continue to have a majority of kids who aren't yet eligible to receive the vaccine, because we don't have 100% vaccination in any school, masking will continue to provide a safe and effective way for us to have our children be in school 5 days a week safely without concern for spreading within the schools or to families once children go home at the end of the day. So we definitely all have our eyes on the Delta variant. The most important thing that we are paying attention to with the Delta variant is how contagious it is. It's incredibly contagious and much more contagious than the other varieties of COVID that we have seen, and even higher than a lot of respiratory illnesses that we've seen even before COVID. What that means, particularly in school settings, is that knowing that now approximately 70 to 80% of COVID that we're seeing is the Delta variant, that if we start to see it in our schools, it can very easily spread, and it most easily spreads in unmasked populations, in unvaccinated populations, and in indoor populations. And so we will continue to watch this. We are very encouraged that the vaccine is still doing a very good job protecting people from serious illness and death, even from the Delta variant. But we want to be sure that we're able to keep our schools open, and so we have our eyes open about how contagious the Delta variant is. Thinking about other ages being allowed to be vaccinated, we feel very confident that the next set that's under consideration is kids 5 to 11 years old. Here at our office, we have participated in that study, and so we know that that has gone very smoothly, and that data is going to be submitted hopefully in the next month, sometime in August. The FDA has recently said that they would like to see 4 to 6 months of safety data before they will approve kids in the 5-11-year-old group to start getting the vaccine. So we don't think it's likely that kids in that age will be able to start getting vaccinated until mid to late winter. So we expect November or December would be the earliest to think about that. And remembering that with the Pfizer vaccine, which is the one we're talking about, there's 2 doses 3 weeks apart and then 2 weeks to be fully protected. That's 5 weeks that we need from when the vaccine is approved for those that population to be protected by the vaccine. Last year, if your child was exposed to coronavirus, it meant that they needed to stay home for 14 days, 2 full weeks out of school. If your child is 12 and up and vaccinated, the great news is that even if they are exposed, they will not have to stay home for that quarantine period. And so that will keep them in school for more days, which is our goal. Additionally, if masks are worn inside and the other mitigation strategies are in place, Also, kids will not have to stay quarantined for that 2 weeks if they are exposed. And so that will help us towards our goal of having kids be in school as many days as possible. Please, if you have any questions at all about the coronavirus vaccine, about masking, or anything related to coronavirus and schools, or how to keep your child and your family safe, please reach out to your doctor.
I would like to thank everyone for their cooperation with our mitigation strategies last year. Thanks to consistent compliance, disease transmission in the school was rare. I would like to tell you about a few changes to our mitigation strategies we made based on updated public health guidance. On July 8th, our school board approved of an update to our mask policy that masks are no longer required outdoors. They're still required indoors and while traveling in any of our buses. A new statement was released by the state this week stating that mask mandates can now be a local school division decision based on community metrics, vaccination rates, and our ability to implement other mitigation strategies, as well as guidance from our local health department. We also changed student spacing per updated CDC guidance from 6 feet to 3 feet. And finally, we will no longer be doing temperature checks daily upon building entry. We continue to closely monitor the pandemic metrics of case incident and vaccination rates, and work closely with our local health department and area physicians. We will communicate with the entire school community when further changes are made to our mitigation strategies as the pandemic evolves. We are working as hard as we can to ensure that the schools are open 5 days a week for all students. Thank you for your cooperation as we work through this. We know it's not been easy, but we really appreciate it, and we're looking forward to a school year where our students can stay in school the entire year. Thank you.